how should men be involved in this whole concept of family planning?
For this thing to work, you must be committed, dedicated, and not just you. It is you and your partner. The only hours that makes us slaves of these foreign things that I don't want to go deeper, we've already spoken about, is only between 20 and 21 hours in a whole month. Why would you be a slave of something that you have control over?
Welcome back to the show, and we've been having a very, very interesting topic, a very interesting time. We've really learned a lot. Kwa wenye wamekuwa wakitufuata, we've really been learning. By the way, kuna mambo mingi sana nimejua tu saa hii kwa hii show. Sometimes naona kama ni mimi nilikuwa nimekuja kufundishwa. That's how much it has been nice. So before tuende break, kuna swali nilikuwa nimeuliza na ndio tutaendelea. Our guest will tackle that and then tutaendelea. So this was the question. Mostly tumekuwa tukiona mtu akianza kutumia family planning, somehow their body changes, either you become slim ama unakuwa mtu mkubwa, kama ulikuwa mdogo unakuwa mtu mkubwa all of a sudden. Is that something associated with family planning? Kuna any relation na family planning na hiyo body changes, ama ni mtu tu anabadilika tu naturally?
I would say it is not a coincidence that tumeanza kutumia the moment tumeanza kuzitumia. Maybe you got married, you are the hourglass shape, and then when you are doing your wedding, 1 year later, 2 years later, you have your first baby, and then you introduced into this artificial, one of them, methods, and then all of a sudden the body you become this, what do you call it? Is it the apple shape?
The inverted triangle.
Yeah, such that when it is a little bit dark, you can't tell, when that someone is standing, you can't tell whether they are facing you or they are facing the other end. Yeah, so it is not a coincidence. You know, the body of a woman is majorly controlled by hormones. And these artificial things that you're introducing into your body, they are artificial hormones. So what happens when they get into your body? They interfere with the normal function of the normal hormones. So they interfere with the normal. So you become abnormal. So even the body physique could be abnormal. You don't expect, you do abnormal things, you expect normal results. There's nothing like that. Yeah.
So when we went for a break, the others zenye umeniambia umekumbuka, the artificial contraceptives.
Oh yeah, I forgot about the Depo. The Depo-Provera. It's Depo-Provera. It's an injection you're given intramuscularly, and it lasts for 3 months. It goes for 3 months, and then you go for another one, and on and on and on. But one of the side effects of that thing is your menses can disappear for the longest. Can disappear for a week, for a month, for years. And others goes completely without ever coming back. And you see, if you still want to have babies later, that can affect you, because the return to fertility period may be prolonged. You know, for like the ICD, the coil one, that one is a little bit better, because the moment it has been removed, the return to fertility period is less shorter. Yeah, actually you can be removed today and next month you've conceived, or even you conceive the same month. Yeah, so that's an advantage of the IUCD. On the contrary, for this one, you may never ever get pregnant again. Some also get pregnant almost instantly. So bodies, we are different.
We are different.
But people should know that it has that side effects. It is affecting many women. There are issues to do with bleeding beyond the normal days, or abnormal menses, irregular. And in most cases, many of them get to have menses more than once in a month. And now that you can't call it menses, now that's bleeding, because you are supposed to bleed once. Like you only have one cycle in 1 month. You can't have 2 cycles in 1 month as a single person. It is not possible. Because on a monthly basis, like you're supposed to produce 1 egg in 1 month. So you cannot produce 2 eggs in 1 month. And the moment you see you've bled more than once in a month, that's an abnormality that must be treated. Yeah.
So there's this also another thing that people say, that there are some contraceptives that raise your libido. Is that true, or is it a myth?
Okay. If there's any, someone should show me and bring it to me, and I get to see it. Raising your libido. I think maybe they confused. It is lowering the libido, or completely getting away with the sex drive. Yeah, it is nothing like raising with the artificial methods of birth control. In any case, it does away with your libido, some of them, and you're not attracted to your man anymore. Your system is distracted. There's no, some of these methods, you're not able, your egg is not able, your ovaries are not able to produce eggs to maturity, an egg to maturity. And that's where it gets you into you getting fertile or being fertile, for your body to be able to, for you to feel now you want sex, you want to have it. You know, your body tells you we need a baby. Yeah, so it does the opposite.
It does the opposite. So I think we cannot exhaust questions concerning the artificial methods of family planning. So let's now shift the gears to, okay, before we want to focus on the natural methods, but before we get to that, I would love to know how should men be involved in this whole concept of family planning. So that's question number 1. And number 2, are there any maybe methods that have been discovered that men can use instead now of burdening the women?
Okay. I think in the society we live today, when it comes to matters birth control or family planning, it has been left almost entirely for women to think through, to plan, to decide which method to use. But it should not be the case. This is a couple, it's a matter of the couple. It should be planned by the couple. They should be the ones deciding. You know, even when you walk into a health facility and you request to get the services, those services, the family planning services, they are supposed to put everything on the table, all the methods, the do's and don'ts for each, the advantages and disadvantages for each method. Then it is upon you as a couple to decide which method you want to
go with.
It is not upon the health worker or the healthcare provider to decide for you which method you are going to use. Having said that, men, I'm talking to men, you're supposed to know what you want, your woman, your wife. So you love them, I suppose.
Yeah.
And that's why you live together.
Yeah.
And that's why you're having babies together, of course. So you should be knowing what she's using. because in case of any issues, if she's using a method that may bring about issues to do with health issues, you'll be involved. You're the one to pay for that hospital bill.
Yeah.
You're the one to be left with those little ones to take care of.
Yeah.
When the wife is
in the
hospital admitted. So right from the word go, you should be involved in what they are using. When you decide you need a family planning method to start using, walk into the hospital with your wife. Get to know which methods. Decide which ones. And even before, for example, you decide we want an implant. Yeah. Before it is done, there's always a drug literature that is put inside. It is an insert that is put in the drug carton. That is it is always there by law. Any and every pharmaceutical company should put that insert there for everyone for the user to be able to read before they use it. So request for that thing or that insert, go through it. You have any questions, ask the healthcare provider, because you have the right to get all the information correct before it is administered to your wife. Because in case of any problems, it is you to carry the burden. So go through every detail that is written there. If you have any questions, ask. If you're okay with it, then
you
go ahead and she may go ahead and get it. Yeah. So be involved as husbands. Be involved with whatever is happening to your wives. After it has been administered, you've known her for 1 year, 2, 5 years, 10. If there are any changes that you feel she could be undergoing and maybe she has not noted, or maybe you have not noted but she has and she's raising it, maybe headaches, maybe fainting, maybe bleeding, or the menses have disappeared and she has raised it with you, please get involved. Get to know what is happening. Get to know what is happening. Go with her back to the hospital. It is not a crime. Go and ask a question. Go and get the clarity. If you feel you want to continue with the same method, well and good. If you feel you want to stop it, it should be removed. Even if it has taken 2 months, you have used it for 2 months and it was supposed to go for 5 or 10 years. It can still be removed. It is your right. It is your body. So please, men, be involved. That is what I wanted to stress on.
So talking of getting involved, can you also get involved by, are there methods that they can also get involved and help us
carry
this burden?
Yeah, we have a few methods for men. One is vasectomy. Of course, that one I say it's going too far. For myself, I don't advocate for it. But of course, you're given what you want. If that's what you want, then well and good, you're given. There's also these other, and it is effective. We also have the CDs, the condoms. That one they wear, they dispose. We also have the creams. There are creams, but I'd also say the creams are mostly because you apply it to your woman before sex. It is for killing the sperms. It is spermicidal.
The cream, is it applied externally or inside?
Most of them are applied inside, because of course when the man ejaculates, the sperms goes inside and they are left in the vagina. So it's applied on the walls of the vagina.
And they are not harmful?
They are not. They are not harmful, they say.
Wow, I've never heard about it. You should consider the cream if you are tired of these other methods. Is it available in our country?
It is there. It is there in some pharmacies.
High-end pharmacies.
That's the word.
Okay. then umesema there are condoms and then vasectomy. Vasectomy, is it reversible?
It is not. You know, it's cutting of that tube. Yeah. So anything you hear, it's Tommy. So inamalizia na Tommy, vasectomy, lubectomy. It's cutting.
Okay.
Yes, it's cutting.
So when it's
not
done,
tying. You know, it is not tying. I've not had that one for tying. But this one is cutting.
Okay.
Yeah. So once you cut, there's no
reverse.
Yes, there's no transport of these sperms from this area to this other. Is that gap.
I had a question about vasectomy. When a vasectomy is done, because there are some people who might want to go that way. When it's done, does a man ejaculate?
They do, but there are no sperms.
Oh, the sperms
zinaendelea. There are no sperms, but that fluid still comes out. But sperm-free, spermless.
And it said that sperms zinakaanga zikikuwa manufactured.
Every day millions.
Every day millions.
In millions.
So that means if they are not coming out, they
are absorbed by the body. That's why.
They are absorbed by the body.
That's what I would say. You see, even for the animals, a very good example. Something like, what do you call it? This is the male goats. These male goats, once they are, we use bandizos to do what? To do that to them. And then, what happens to that male cow or that male goat? What happens? It is very clear that even the farmer who was doing it, they wanted that thing to fatten. To fatten up, to stop using so much energy on mating, and not even to have, you see, the signs of mating, like the urge to mate. They concentrate on the body fat, the body energy. It concentrates on the flesh, like they become fat.
Or maybe because the goat is for sale.
Yes.
Ya nyama.
Yes, they become fat. Zinanona. Why do you think that cannot happen to that man? What makes you think that for a man it is different?
Ataanza kuna. Oh,
ndio umesema hiyo sio mimi.
Oh my goodness. That's interesting. So sperms zikikaa sana kwa, is it a scrotum ama hii scrotum haita burst or
no.
So they are absorbed by the body.
Yeah.
Oh wow. Okay, that's it about the men. Yeah. So anyone who wants to go by that, you can.
Their choice.
It's your choice, by the way. So when we were outlining, our guest said that there is artificial methods, and then sahi tumeongelelea kuhusu the men, what men can do to also assist in family planning. And then there is a natural method. And so right now I would like us to discuss that, how possible it is. Does it have any effects? Acha tuichambue tujue how workable it is. What is this we are talking about?
Yeah.
And is it workable?
I know. This is the elephant.
This is the elephant in the room. Yeah, and because people are suffering out here.
Yeah.
Na hizi mambo ya blood pressure, nini, mood, hormonal changes, all these things. Yeah. So we are trying to understand, is there any other remedy for this? Maybe tunaweza saidika. Yeah.
Luckily there is the natural family planning, which is again luckily, which is my area. That's my interest. My area of interest.
That's the gospel you want.
That is the gospel I preach day and night. That is where I want people to go. That is the way I would like the world to live. I call it the godly way because you're not introducing anything into your body. You're not interfering with any mechanisms of your body. You're not doing nothing to your body. Yeah? Number one, it has some topics, it has some methods, but I'll start with the main one. It is the calendar method. That one you count days. You count from day 1, the day you spot, to the 13th day. You're free. Do I call it safe? I don't want to call it safe, because when it comes to these, we help 2 groups of people. We help a group that wants to avoid pregnancy. That's number 1. We also help a group, a very important group, that wants to achieve a pregnancy. And that's a very important group. So when we come to these, we cannot just discuss about how to avoid pregnancy, how to be safe, how to be, that's why I avoid the safe word. Because there are those people who, those days that you're calling safe days, they are calling them like their savior days. We may put it that way, honestly, because they are really trying to achieve a pregnancy, a baby, after all. So, from the day 1, from the day that you see the very first spotting, or the very first drop of your menses, that is your first day of your periods. You count all the way to day 12, or day 13, or the 13th night, and the 14th day. When after your menses have started, that is the time you're fertile, highly fertile, and that is when the egg is being released into the fallopian tube for the sperm to swim up and fertilize and conception to take place. On the 14th night, between the 13th night and the 14th day, it takes the egg only 21 hours to survive, like to be there, alive. If it doesn't get fertilized, if a sperm does not come up and fertilize it, the egg dies off. So from the 15th day, the egg is dead. You see, some of us were brought up from the village setups. Our cows used to move, napiga kelele sana that night, or that same night. So you hear your grandma or your parents saying, tomorrow morning we are taking it to the milk cow for that. And if they don't, you would observe that by evening or the following day morning, that cow is quiet. It is quiet. And it will be like that until the following month. So they used to rush. They know the timing. So even animals know. We are mammals. We are mammals. We are just like the cows, the dogs. And another example, having brought up in the villages, you would see dogs following each other, like 15 of them, following a female one. During a certain season. But after that season is gone, you'll never see those dogs together again until the mating season the other season comes. So the animals know their bodies. They get to know it. The male and the females, they know. They know. They know. So they don't even mate the other times. They are not like humans.
They're not like humans.
They are not together. They don't even care what you're carrying, what I'm carrying, or what we have, we don't. They wait until their bodies talk to them and get to communicate. And therefore, so what I was saying is, on the 13th night and the 14th day, that is the time a female or a woman is highly fertile. That is when the egg is being released, and has been released, and is ready to be fertilized. So on the 15th day, after 21 hours, the egg is dead.
And nothing can happen after
Even
that.
IVF cannot work. So, before the 13th day,
Mm-hmm.
it's very hard for a woman to conceive. Um, and after the 15th day, going forward.
Mm-hmm.
Actually, for the 13 days, the egg was getting ready. It was growing. It was getting to mature until the last minute. It matures. It is ruptured then.
Mm-hmm.
But on the 12th day special, we will come to that.
Mm-hmm.
From the 15th day to
Mm-hmm.
the 28th day,
Mm-hmm.
the body again starts getting ready to shed off.
Mm-hmm.
Because when the egg in the first 13 days, the egg is maturing up.
Mm-hmm.
Then it has matured up.
Mm-hmm.
It has fallen onto the fibrae part of the fallopian tube.
Mm-hmm.
It is waiting for conception to take place.
Mm-hmm.
So what happens to the body? If you happen to have sex at that point, there is conception.
Mm-hmm.
So the body is told now there's a baby on the way.
Mm-hmm.
So what happens? The body again, this is a game of the hormones.
Mm-hmm.
The hormones again starts preparing the inner lining of the uterus, the endometrium, thickening it and making it heavy for the baby to come and find a landing place for it to be taken care of for the next 40 weeks or so. So what if the conception did take place? Now the reverse starts happening from the day 15, from the 15th day. Between day 15 and the 28th day, those are another 13 days or so. First 13 was preparation. Now these are the 13 days. The body starts getting ready to shed off the endometrium as menses, which sheds at the 28th day. Now, I mentioned about the 12th day. The 12th day, if after sex, sperms can go up to 3 days, 72 hours alive in your body. Zimenyamaza tu, they are there hiding somewhere, zimekwama.
72 hours is 3 days.
Yes, 72 hours, 3 days. So, in case you had sex on your maybe 12th day and the egg was released on the 14th day, let's say, there are sperms that could still be there. So, by the time the egg is coming, there are sperms there somewhere. They are being released now. They come in, and fertilization takes place. So, you can still be fertile. You can still conceive when you had sex on your 12th day of your cycle. So it's possible. Yeah.
Or even 11.
Or even 11 at night 11, there, around there.
12.
So you can always count. Yeah. So what I was driving to is this misconception of women are fertile every day. No. No. That's a lie. It's a lie of the devil because they know it's an agenda, and we all know that. We are not fertile every day. We are not. Actually, I've mentioned we only fertile for 21 hours. In all the 30 days, 21 hours. You can see in a whole month, let's say a month of 30 days, that's how many hours? 720. 30 days times 24. I think it's 720 hours. You can even say 700 hours you're free. Why should these 21 hours make you a slave of someone else?
Contraceptives.
Yeah? Yeah, so people should seek for knowledge. Yeah.
Let me ask this question. In a world of so much stress and so much work to be done, people are busy every day.
Yes.
How is it possible for me maybe to keep track on my days? Hata sikumbuki nilipata periods lini, ziliisha lini, which is my 13th day. How do we do this?
For
it to work?
For this thing to work, you must be committed. dedicated, and not just you. It is you and your partner.
That's where the husbands come in.
It is you and your partner. That's why I started by saying that it is not workable. It is not practical if you're just doing it alone. Because imagine you're 13 the night. Yeah, he's come, maybe he's drunk, and he wants it. And you have no other method you're using. So if he doesn't comply, you may end up having a baby. So both of you must be sober. You must be committed and dedicated to do this. You must say, this is the way we are doing this, our thing. We are not going to use what the world is saying, or we are not going to go with the wind. We are going to do this. We are going to know our cycle. We are going to know our days. And we are going to get to understand our body. That is your body. You understand it, both of you. For you to be able to be practical. Because there are some recordings that you need to do. And you need to do it, both of you, at the same time. For you to be able to interpret well. And be able to get to know when you're safe, when you're not. Because, like this method that I've just explained, it is not for everybody. It is not for everybody. It's mostly for the 28th day cycle women. For the others, it is still workable.
That's where I was coming.
We got to learn their cycles and work with them for some time, as we teach them. It's not a one day event.
So this one that you said, it only works for those when you are on a cycle at 21 days.
28.
Or 28 days.
Yes, 21 is complicated.
Okay.
Yes.
Ebu kwanza tueleze, how many cycles are there?
There are many cycles. There are there's a woman who is 21 days, who has a 21-day cycle, 26, 28, 30, even others for 34. Surprisingly, I've even had clients with a 19-day cycle. And such a cycle, I tell you, such a cycle. Most of these women are the ones that we call quote-unquote barren, because they don't even know when
when they are fertile.
Yes, they cannot tell. They cannot tell. Like, it is the opposite of the others. It is so complicated.
Oh, there is that.
There are some women whose when they are releasing their egg, because the egg release and the menstrual cycle, and I mean the menses, those are two different things completely. So there are women whose cycles are so complicated that when they are releasing their egg, when the egg is maturing, when it is ripening, now very much ready, that is when the menses are coming.
Oh.
Yes. So that's why I'm telling you that this method you need someone to take you through, slowly by slowly, month by month, for some time. We get to know your body vizuri, we understand it, and then now we advise you correctly.
Okay, so that one was for 21 days. But now tell someone when you're gonna maybe 28 or 30.
So that one was for 28. Yeah. So these others, they are different, and they are different, and especially if you've used the artificial methods, your case is not someone who has never used anything else before. So first of all, factory reset that body before now you get to know, because there are some, most of them who are outside 28 with an abnormality, let me say. Some with birth, they were born with the same issues, maybe high, some of them high levels of hormones, like FSH, is a hormone we call follicle stimulating hormone, that starts to mature, grow the egg and it gets to mature. So if maybe you are born with very high levels of that, we need to bring it to the level first, the right levels for you to be able to, for us to correct your cycle. Yeah. So every cycle has its own. Every woman has their own teachings. Yeah. Okay. Yeah. After we do our own investigations, then we get to know what could be the issue.
So you talked about the first method of your natural. You said is the calendar.
Yeah.
Is there another one?
Yeah, we have another one. And before we go to the next one, those 21 hours fertility period, that fertility period, now you decide to do whatever you want to do with them is up to you. Because
you can decide that's the night you want to have a child, or the night not to.
Good. There are those who want to avoid it, to avoid sex. There are those who want to. That is the time I'm taking these nachukua ndege to my husband. I want that.
You want a child.
A child at this point.
Yeah.
So now the next level and the next method is called the body basal temperature method, or basal body temperature. That one you take your temperatures every night. Every morning. Body temperature every morning before you move out of the bed. Yeah, even before you move.
What does temperature got to do with all this?
Research or science has shown that after ovulation, the body rises a little bit. The body temperature goes higher, very slightly high, between 0.5 degrees to 1 degree. You know, that's a very small
margin.
Yeah, very small. So you must be very accurate, and you can't do this alone. That's why I'm saying you need your partner to do this. So before you wake up, just take your thermometer, put it under your tongue, take the measurements, record. Same case tomorrow and the other day. Yeah, so that's it. Yeah, that's it. So like you expect to, and as you record, there are two plateaus. So like before ovulation, the temperatures are a little bit low. Ovulation, zinaenda chini, zinaenda juu kidogo, then it goes a little bit down. So you're able to know, I have ovulated, I have not. Yes. So that's another method.
When you're ovulating, the temperature is low. Is a bit low.
Yes, it's a bit low.
So that's when ukiona temperature yako imeanguka, unajua this is the time.
Ukiona imeenda juu, that's when you get to know that I've ovulated already.
Oh. But we want to track this day ya ovulation.
That's where
ni gani ni yenye temperature iko chini.
That's where I'm going. This is a method inaitwa mucus. Mucus, the cervical mucus method. The best thing is to use the two pamoja. That's why I want to explain this one, and then I give you the both at the same time for you to be able to use both. So this cervical mucus is when you observe the cervix, the mucus of the cervix. When you're fertile, you have this mucus that is released. That is not cutting. It is flowing without cutting. It is consistent. Yeah. That's when you get to know you're fertile. When it is the mucus is just disintegrating. It is not flowing. It is not like together. You're not fertile. That mucus is not. It tells you that you're not fertile. Yes. Now, when you combine the two methods, it gives you the best results ever.
It's given that when the temperature is low and then the mucus is a bit umesema flowy ama thick, that means you are ovulating.
Yes.
And at that time you can decide now you want to conceive or not.
Yes, you use the days as you prefer. If you want to conceive, use those days as they are supposed to, according to your needs. So that's why I'm saying we help both groups, those who want to conceive and those who want to avoid pregnancy. Yeah.
You can decide what you want to do in those days.
What you do in the days is up to you.
Okay, so natural method, can you say it's what's the other I can use? Unaweza sema ni kitu people can rely on.
Yes.
Without using any artificial.
Exactly.
Without using any condoms. You can go with it now. You are sure that with this I cannot get pregnant, or I can
every day, I want to. Every month through the year, and you'll be safe.
Are there factors that can change maybe your cycle, ama upate you are not being able to track your ovulation days? You are not able to track, maybe kuna mambo imeingia ikafanya, maybe your body has changed and sasa you cannot go with the natural.
Yeah, as I said, our bodies talk. We no longer observe ourselves. No longer listen to our bodies. Because if we didn't have them, if we didn't have these artificial ones, and surprisingly, they are not here for even 90 years. They are like, I think, at most 80 years since they came. So what do you think our parents and our grandparents were using before? They were using they used to observe their bodies. The same way you see them observing the animals, so they're able to tell. The animal is fertile at this point. If mating happens, we'll have a calf next year. Yeah. So they knew, and they know, they still know. Some of them look at us and they feel like beating us because they wonder, what are you using? What is this that you guys have been? These alien things that you're using to destroy your bodies. If you look at them, their children are gapped 3 years, 3 years or even more. What do you think they used to do? They used to listen to their bodies. They knew when they were fertile. They knew. And then when they got their babies, they used to breastfeed this child for even 2 years. And you know, the moment you breastfeed, the hormones that are released, they suppress the ones that brings about
conception
and all those things. So nowadays, surprisingly, people fear getting pregnant more than even the diseases. Yeah? You can have sex with anybody, anywhere, at any point.
But you don't care about getting HIV.
But you don't get, there's no fear for infection. Because again, you know, you go for medications again. So the more you're treated, the more the scarring, then more the chances of you not conceiving in the future. Yeah, because for example, like the cervix, if you keep on scarring that area, you know, like when you're having sex, first of all, the cervix is only open on 2 occasions most of the time: when you're having your menses and when during childbirth. All these are the times that your cervix is closed. That's when you hear medics telling you, when you want us to give you or to install an IUCD, come like 2 or 3 days after your menses, for us to be able to, because they know at that point the cervix is open. Yeah, so it will be comfortable for them to insert it, and you'll be comfortable. But all these other times, the cervix is closed. But when you're having sex, it is special. Yeah, during that excitement, that's why you're supposed to be well prepared for sex. The body should be excited. During that time, at that point, the cervix opens up a little bit for the sperms to swim through. Yeah, and go up to take the care of the rest. So if the scarring, if this cervix has been scarred and healed, so it is scarred, it gets tough or difficult for this cervix to open up for the sperms to swim through. So it also becomes another reason for many not to ever conceive or infertility, to bring about infertility. Yeah.
We cannot exhaust this.
Yeah, sure, I know.
It's a lot. Mambo ya family planning, there are so many things that people need to learn about, and we cannot exhaust it in this one video. We need to have you here once again, sababu hata kuna mambo nimeona hatujaongelelea BTL. And it's also important.
Yeah, I know.
It needs another whole video, na tutakuita tena. So right now, I would like you to give us a parting shot. You can use that camera, you address our audience, and tell them something. Give us your contacts, maybe how they can find you, how they can talk to you. Maybe someone anaweza kuwa na swali personal anataka kukuuliza. You can give your contacts. Yeah.
The only hours that makes us slaves of these foreign things that I don't want to go deeper, we've already spoken about, is only between 20 and 21 hours in a whole month. Why would you be a slave of something that you have control over? Get to know, what I say is get to know your body, listen to your body. If you can't, talk to me and I'll be able to take you through. This is what I do on a daily basis, day and night, based in Westlands. But nowadays, people don't even meet physically. If you want to see me physically, you can always do a video call or even a Google Meet. That's what I mostly do with people. I schedule them and then we see on how to help them. Yeah, so, and we also do skin rectifications using soaps, creams that are natural, based with the natural ingredients, because of many people's skins have become issues, have become problematic because of the detergents, because of the chemicals that we've been using. They are corroding our skins. So we have all those things to bring back the natural you, just like you look, without layers and layers of makeup. Yeah. So my phone number is 0725 285 258.
You can repeat again.
Yeah, 0725 285 258. You can always give me a call, and we plan on how we are going to help you. Yeah.
Okay, we will pin the number down there. Na if you have any questions, we will invite her again here. Tumesema kuna mambo mingi sana bado hatuja exhaust. And so leave your comment, tutaisoma, na if you want to talk to her personally, namba itawekwa hapo. You can call her, you can talk, and we are doing this to help our sisters, families, because tumeambiwa kama vile amesema, we only become slaves of contraceptives because of only 21 hours. If we are just able to, if we are just willing to get educated on these things, mtu akuwe willing to learn, how can I go this the natural way? How can I track my cycles? How can I track the days that I'm ovulating? It would be much easier. So let us be committed to these things, and I know we will have a better society and people who are not so stressful, so moody, and good families and healthy children also. So this has been it for now. Make sure you subscribe once again. Nitazidi kuambia na kuambia, please help us get this channel to another level. Like our videos, share them, and also leave a comment down below. So it has been a nice one. Thank you for coming.
Thank you for
inviting. And
inviting
you're
me.
welcome for also another day. Tukikuita.
I will come.
Thank you so much. It has been a nice one. Yeah. Till next time. It's a wrap.
Time has come when you will see your miracle. Oh, no. God's approval. Cast is the one who seeks man's approval.